On behalf of the Patient Safety Authority, I would like to welcome you to this webinar titled Long-Term Care Emergency Preparedness Educational Series, Recovery and Reopening. My name is Chris Mamrell, and I will be your moderator for this program. Now I'd like to introduce our speaker for the webinar. Joanne Atkins is a registered nurse and senior infection preventionist for the Patient Safety Authority. Ms. Atkins is board certified in infection control and epidemiology, CIC, and is a fellow of the Association for Professionals in Infection Control and Epidemiology, FAPIC. Ms. Atkins is a 2019 recipient of APIC's Heroes of Infection Prevention Award for Education. She is a member of the Association for Professionals in Infection Control and Prevention and has served on the Member Services Committee, the Sigma Theta Tau International Nursing Honor Society, and the Pennsylvania Association Directors of Nursing Administration Long-Term Care. Joanne, I will now turn the program over to you.
Thank you, Chris. Welcome everyone to the 7th installment in the Long-Term Care Emergency Preparedness webinar series. Last month we discussed shelter in place or evacuation. Today's webinar is focused on issues and tasks involved during cleanup and reopening of an evacuated facility due to a disaster. This is an area that the facility IP is extremely involved in. So here are our objectives for today. To list the 4 steps involved in reopening a facility, review the evaluations and major activities involved in structural recovery, and discuss the importance of post-reoccupation inspection and surveillance. During a natural disaster, many facilities may suffer water and wind damage. Some may have standing water for an extended period of time due to flooding. Building structures, equipment, and supplies may be heavily contaminated with microorganisms or severely damaged structurally. This means making a thorough evaluation is vital. Disaster and crisis planning are primarily focused on preparing and responding. However, another critical component is the recovery phase, which is what we're discussing today. At this point, the worst of the immediate or acute crisis has passed, and the facility can begin focus on returning to standard operations. From a facility standpoint, recovery often means looking at the infrastructure of the facility and making determinations if the facility is still operable and capable of taking care of residents. Everything takes a team and everything is multidisciplinary. Recovery should be coordinated with others outside of your facility, such as your local emergency management, public health, food delivery services, utilities, etc. Recovery involves taking a complete look, not just at the physical structure, but also at those types of needs that support a safe and effective operation of your facility. So that being said, where do you start? Once a decision is made to repair and reoccupy the building, the steps involved are evaluation, remediation, and structural recovery, restoration of services, certification for occupancy, and post-reoccupation surveillance. And I'm going to discuss them in more detail. Building structures, equipment, and supplies may be heavily contaminated with microorganisms such as mold, mold spores, and bacteria. Before reopening, an evaluation is necessary to determine if the facility is damaged beyond repair and must be condemned, or if the extent of the damage is such that the facility may be restored, repaired, and then reopened. After that evaluation, if the decision is made to repair and reoccupy the building, then remediation starts. Damaged or contaminated materials and structures must be removed and discarded, and salvageable materials and items must be thoroughly dried, repaired, cleaned, and restored to a safe function. The restoration of a facility to full function is a complex task and will require the assistance of others. You may need the assistance of engineers or professionals that are trained in building remediation, and also manufacturers of your healthcare equipment to make sure that the materials are safe to be used. This slide lists the tasks involved during cleanup and repair of a damaged building. You need to think about worker health and safety, mold remediation, structural recovery, water and electrical utilities, ventilation system, and structural building materials. Worker health and safety. The persons who are involved in the cleanup and remediation need to be protected from infectious disease, chemical exposure, electrical shock, potential fire hazards, to name a few. The link on your screen is to the CDC website that has excellent information for cleanup and what workers are required to wear for PPE and ways to keep the workers safe while they are working at your facility. The building must first undergo a life safety and building evaluation to determine if it's safe to enter before any type of cleanup can begin. Part of this is also making sure there is sufficient safe electrical power to assist in cleanup information. At this point in time, the building is also evaluated for fire safety and protection. Once these evaluations has happened and it's cleared for remediation to begin, then the slide here lists the major activities following that clearance. You need to have restoration of a working sewage system. You also need to have restoration of potable water. You need both of those because without the working sewage system, you would have difficulty extracting the standing water and sewage. You also need installation of appropriate containment for any bioaerosols that may happen with the demolition of the destroyed structure. This is especially important if part of your building is still occupied. You may have had a fire and had to abandon one wing of your building, and now that wing is being restored. As you would have residents in another wing or another floor of your building, then it is necessary to have containment in place. You also need ventilation of the work area, and also to devise a process to remove the damaged materials from that work area. You need to have a plan in place for surface cleaning and disinfection of all non-porous materials, and also for repair and renovation of the structure, and at that point in time, also replacement of damaged items. Another major activity is restoration of power, and your backup generators are evaluated to make sure they are still in working order. A thorough cleaning and disinfecting and drying of salvageable porous items such as curtains or linens. Also, it's important to evaluate your medical equipment, your medical infrastructure, such as if you have oxygen piped in or suction, supplies, records, and furniture for damage. And then also cleaning and disinfecting of resident care areas. So a lot of work goes into restoration and remediation. It is more than just the building. This slide is a picture of a chart that is available on the CDC website at the link on your screen. And I would encourage people to review this chart, and you may want to keep a copy of it with your emergency preparedness plan. This chart makes it's a very easy table for you to use to make sure that you are following the correct type of cleanup and that your workers are wearing the correct PPE and the correct containment is in place. Where you see under cleanup where it says A, B, C, or D, they're talking about whether the surface needs to be wet vacuumed if it's really porous, or there may be mold or spore fragments. B would be just a damp wipe of this with a detergent solution would be efficient. C is when you need a HEPA filter. D is when you need to do containment and any of the damaged materials have to be sealed in plastic bags. But it goes through and lists that. When it talks about PPE, it talks about whether it's minimum PPE, which is the M, which would be gloves, N95s, eye protection, or if it goes to F1, which is full protection, where you not only need gloves, but your workers would need full coveralls, head and foot coverage, P100 respirators. So this is a really nice table to have to help make sure that people are protected that are working within your facility. And this is why I said at the beginning, the IPs are very involved in recovery and remediation. Prior to any effort getting underway, like I said before, you have to have working electrical, sewage, water, and fire safety systems. The integrity of the electrical system, talking about the wiring, the insulation, the generators, must be determined and repairs made so that the workers have adequate lighting and power as needed. The working sewage system is necessary for effective extraction of standing water. A potable water distribution system is evaluated and repairs made as needed. Depending on the event, there may be boil water advisories in effect in your area, and it would be helpful to consult with the municipal water system officials to be apprised of any water treatment issues the community may be experiencing, as it also restores services. Fire safety systems within the building should be evaluated and repaired if needed. Consult with your local fire safety marshal if your system cannot be fully restored prior to beginning remediation work, so that they are aware of that. Your heating, ventilation, and air conditioning system, or HVAC system, needs to be evaluated to determine the extent of damage and contamination. This is your ventilation system that everyone within that facility is going to be breathing that air. Professional consultation is helpful in deciding if the system needs to be replaced or if repairs and cleaning are sufficient. If repairs are done on an existing system, the motorized components, the fan, the blowers, need to be inspected for damage, and dirt and debris need to be removed from them and the ductwork. Surfaces should be disinfected with EPA registered disinfectants designed for ventilation systems, and any filters or insulation replaced. When they are working on your ventilation systems, some of the things to think about or consider when this remediation is happening is to isolate that work from other cleaned areas of the facility through the use of barriers, negative pressure, or venting exhaust air to the outside. The workers should have respiratory protection and protection for skin, eyes, and hearing. Before any remediation of your HVAC system takes place, the professionals need to determine if asbestos is present within that system, because then that leads to even more remediation. Any water damaged insulation in or around the system should be removed and replaced. The surfaces within the system should be cleaned and disinfected, and if this is not possible, then the damaged equipment should be discarded and replaced with new. Your structural building materials require remediation for mold. Mold remediation requires physical removal of the mold. You can't just disinfect it. Visibly contaminated and damaged materials must be removed. Plastic sheeting or bags can be used to contain these items to minimize dispersion of the spores during removal. The contaminated materials, once removed from the facility, are discarded as routine construction waste. Any porous materials or items need to be discarded, and think of furniture if they have been submerged, are difficult to clean, cannot completely dry out within 24 to 48 hours, or if odors remain. Hard, non-porous surfaces or items can be cleaned with detergent and water and dried. As your remediation throughout your building progresses, the damaged structural materials are replaced, existing materials are cleaned, and the area is dried. When this is finished, there should be an assessment done for any residual moisture within the structure materials, usually done using moisture detection devices such as moisture meters or borescopes. And I'm going to say it again, because of the potential for mold growth, any structural material that cannot be thoroughly dried out within 24 to 48 hours should be removed and replaced. Once remediation of the structure is complete, the focus then turns to the restoration of services. Your medical equipment, devices and supplies, food services, and I'm also adding laundry to that. All of these should be inspected to determine what is salvageable and what needs to be discarded. Laundry is a service that needs to be evaluated and restored. Ensure there's a stable electrical power, a potable water system back online, and a natural gas supply restored. The laundry equipment should be assessed to see if it is functionable or can be restored to function. This is when you go back to your manufacturer. Check with your manufacturer of this equipment for guidance on cleaning and drying, or if it would need refurbishing. Items that can be salvaged should undergo appropriate cleaning, disinfection, and recertification as per the manufacturer's instructions for use. Medical equipment, devices, and supplies. These are your sterile supplies, your pharmaceutical supplies, durable medical equipment, clothing and laundry, furniture, linens and curtains, medical records. Consider the following. Linens and curtains may be salvageable by removing soil and laundering in hot water and hot air drying. If discoloration remains visible after cleaning, then you may want to discard the item. Upholstered furniture, draperies, and mattresses that have been underwater or have mold growth or odor are discarded. Non-porous furniture such as plastic or stainless steel are salvageable if cleanable. Any furniture made of particle board should be discarded. You cannot sufficiently dry that. When it comes to your supplies, packaged supplies should be inspected for tears, dampness, visible moisture, mold growth, or signs of having been wet, such as a water stain or discoloration. If any of those are present, then those supplies need to be discarded. Sterile supplies in undamaged, intact, waterproof packaging may be kept. When it comes to medical records, I know most people have electronic, but there's still some paper portions of that. Essential paper files and records. One thing that is recommended by the CDC is to protect those in plastic sleeves or wraps and photocopy them, if possible. Professional conservators may also be contacted that may help you with paper items and records that must be kept. When it comes to food services, special care has to be taken to ensure safe food preparation and service. Identify and throw away any food that is not safe to eat, and assess your preparation equipment for damage. Replace and repair as appropriate. Evaluate natural gas line integrity and verify the potable water lines to refrigerators and washing equipment are flushed once service is restored. Evaluate and stabilize the cooling capacities of freezers and refrigerators before adding any items. All food contact surfaces are cleaned and sanitized before any use. An occupancy survey will be required following remediation prior to opening. Reopening and recovery is followed in accordance with your state and local certification requirements and completion of building and fire inspections. After successful remediation, repair, and reopening, the job's not finished until after the inspections and certifications are completed. Now, this is where you as IPs really come into play in this function. This is the post-reoccupation surveillance. This is periodic inspection of the remediation structure and surveillance for unusual clusters of disease or pathogens. Periodic inspection of the remediated structure is necessary to look for mold growth and initiate removal and control measures. Clinical and laboratory-based surveillance in the facility for unusual clusters of infectious disease due to pathogens in the environment is also essential. And as IPs, surveillance is something we do on a daily basis. The facility's medical director, infection preventionist, and laboratory consultant should determine a period of enhanced review of all clinical microbiology reports to determine whether residents in the reopened facility are acquiring infections attributed to Aspergillus species or other fungus, non-tuberculosis mycobacterium, Legionella, or other waterborne microorganisms. If these are identified and the need for active investigation is identified, then environmental sampling may be indicated. So, like I said, this is the one piece of emergency preparedness that IPs have a big role to play. So I do have some tools to show you. These are recovery checklists. These were developed by the Minnesota Department of Health, and the link is on the bottom of the screen. It is part of their emergency preparedness toolkit. They have a recovery checklist where you note the date that certain things were completed prior to your reopening. And it is a very easy to use checklist. I would advise you to go out and take a look at it on the website. They also have, it goes into not only looking at your consulting with emergency management agencies or fire safety, but also then the basic parts of your facility. Is air conditioning or heat working? Do you have staffing available? That sort of thing. So I really do encourage you to take a look at those checklists to see if you would like to incorporate something similar into your plan. And then the other tool I have for you is a really nice infographic that's at the link on the CDC website. This is a quick glance at what equipment is required for the workers who are doing the cleanup to wear to be safe during remediation. And then, of course, you always have your IPs here at the authority for questions or concerns. And then I also have our two experts in emergency preparedness who have been on our webinar series with this, for which I am so grateful. Jason Brown is the Director of Healthcare Emergency Management for Public Health Management Corporation, or PHMC. PHMC, in cooperation with the Department of Health, provides management and oversight to Pennsylvania's hospital preparedness program, and Jason brings over 20 years of experience in emergency management and response. Pamela Drake is an experienced emergency manager with a demonstrated history of working in the healthcare industry as well as government contracting and university settings. She is the Deputy Director for Healthcare Emergency Management at PHMC and an intermittent agency representative public health advisor for the U.S. Department of Health and Human Services. Do either of you have any comments before I turn it over to Chris for questions?
Good afternoon, everybody. I don't think so. I think you did a really great job covering the topic, as always, Joanne. The only thing I'd really bring to the table here is be sure to balance your concerns with any regulatory bodies with. Don't let that stop you, I guess I'm trying to say, from reaching out, making contacts with either your healthcare coalition or your regional manager with the PHMC folks, or Joanne and her colleagues at Patient Safety Authority. If you have questions or concerns when you're coming out of an incident, especially something with like a water issue or something like that, ask the questions. There may be things you can save, there may be things you have to discard, but there are plenty of folks out there that are ready and willing to help you through this incident. And don't forget, recovery should start as soon as you have an incident. So going through stabilizing the incident with that lens of what are the things I need to start doing early to stabilize my incident, but also to come out of it in the long run a little bit better off. Oftentimes, the sooner that you do reach out to someone that's a subject matter expert, or at least may be able to connect you with subject matter experts like Patient Safety Authority or your healthcare coalition representatives, the smoother it makes that incident and the outcome, the earlier you reach out. So thank you all.
Thanks, Pam. Okay, Chris, I'm going to turn this back over to you in case there's any questions.
All right, thank you, Joanne. This does conclude the slide presentation portion of our program. So we'll start a brief question and answer period. So I'm going to start off. Joanne, could you just go over again the role of the fire marshal in repair and reopening?
Okay, do you want to take that one, Pam, or you want me to answer this one?
I would say go for it.
Okay.
I think you can answer this one.
Okay, thanks. The role of the fire marshal is you want them to be aware that you are starting your remediation and cleanup. You also want their help to help evaluate your fire systems, and they absolutely need to know if your systems are not operable so that they are aware there could be concerns that happen at your facility prior to have working fire systems, whether it's your suppression system during the, remediation or your fire alarms during remediation, that sort of thing. But they play a key role in this, and you should already have a good working relationship with your local emergency management personnel and your fire marshal at your facility prior to any incident happening.
Great, thank you. We have a couple more minutes, right? Looks like I have another question here I'll pose related to PPE of construction workers. Wouldn't the construction workers' PPE requirements be something their individual companies should keep track of?
Yes and no. Yes, their individual companies should keep track of their PPEs, but our role as infection preventionists is to provide a safe environment for everyone who enters our facility. So as an IP, I am also going to observe to make sure that those construction workers are wearing appropriate PPE to protect them from the potential for chemical exposure or pathogen exposure, that sort of thing. Our role extends not just to our residents, but also to our staff, our visitors, and anybody else within our facility. So it is also our role to make sure they are in the appropriate PPE.
Great, thank you, Joanne. All right, looks like we're just about out of time, so I want to thank everyone for joining us today. If you've experienced any technical issues or you experience any issues accessing the evaluation or the certificate of continuing education, please feel free to direct any inquiries to Shelly Meixel at shmixell@pa.gov. You can see her email address on the screen now as well. And this does conclude today's webinar. Thank you.